Andrew Jernigan and I met in around 2020 on a digital nomad collaboration where we served as advisors to people who were getting started or becoming familiar with remote work. And we worked together on a team. It has been a great privilege to know this individual. Andrew has extensive experience across healthcare, travel, and truly understands the mindset and the well-being necessary to support our international existence. Hello, listeners, and welcome to Nomadic Diaries. It is my great pleasure today to introduce you to our featured speaker and our guest, and that is Andrew Jernigan. Now, I've known Andrew for what, 3-4 years, Andrew?
Quite a few, yes.
Quite a few. So welcome finally to Nomadic
Thank you.
Diaries.
Thank you. It's great to be here with you all, and all the loyal listeners. Give this channel a subscribe and a great review because she's got the best guest on this podcast.
Thank you. Thank you so much, Andrew. And so I just want to tell you a little bit about Andrew. Now, he has lived overseas on several continents, I know, and we're going to find out more details about Andrew's amazing story. He's been an entrepreneurial leader and now especially focused in the nomadic field. And he is the CEO of a company called Insured Nomads. He's always been a very early adopter of both nomadic life and expatriate life. And he's a graduate of Samford University in Birmingham. And let me add, that's Birmingham, Alabama, not Birmingham, UK.
Right.
Andrew is mostly to be found nowadays in his lair in Philadelphia. It's a beautiful lair, by the way. It looks lovely behind you. And
Thank you.
is the father of 3 adult kids. So today, welcome finally to this conversation on Nomadic Diaries.
It's so good to be here with you. And I know you're interviewing today from Mexico, right? And
Yeah.
I just got in from New York City 2 weeks before that from Bahia, Brazil. Some time working from the beach there. It was, and a few days of holiday as well. So it's good to be here with you all.
Wonderful. And I am hopeful that one day you might grace us with your presence in San Miguel de Allende in
Oh,
Mexico.
yes. I would love to.
We are quite the destination, according to Travel and Leisure magazine, unfortunately. So, Andrew,
Yes.
tell us a little bit about what I know your story, but just for context and our audience's understanding, what was the specific incident that sparked your absolute undying and lifelong passion for the insurance business?
That's an easy one. I was working with a multinational organization, had workers in 38 countries, and it culminated, I think, when this one family didn't have insurance. The dad got malaria, needed to be medevaced to a place where there was a hospital that could care for him. They couldn't afford it, and he died, leaving two young children and a wife. No health insurance, no life insurance, no anything. And they were an incredible family. I'd gotten to know them in person, even though I was Northern California based. And then one of their colleagues was on a weekend away with their family, taking a picture of wildlife on a safari, got trampled by an elephant and killed.
Wow.
They didn't have any life insurance. And I was like, okay, international life insurance, international health insurance. Why don't these people have it? And it just frustrated me that I was running into that over and over, where folks just were saying, we can't afford it. But then in hindsight, they were wishing they were paying it. And so it was during that season, I actually had a heart attack, open heart surgery, bypass surgery at that time. And I was like, okay, insurance paid the $130,000 hospital bill for me. I just had the $5,000 out of pocket. And it's like, wow, never been into insurance, never knew that much about it. So I started I left the organization I was with, got credentialed, started representing over 30 of the international companies, only international,
Yeah.
and from companies all over the world. And my background, though, had been in banking, fintech. I had built online banking, was on the early team to build online banking to log in, view your balance, pay a
Yes.
bill, things like that
Yeah.
back in the late 90s. But yet insurance was still so far behind the times. It was still a PDF that you had to control F search it. It was still a thing of fax it in. And it's like, this has got to change. And that led about to a few years later, the forming of Insured Nomads. And so that was the culmination of, okay, people need to get coverage and better needs to be built.
Yeah. And what a journey. It's been really fun to watch you and all the awards that you've won over the last
Ah,
years. Tell
thank
us
you.
about those, please.
It's, this is a hard world to build better, especially in our segment of insurance.
Mm,
There's so much fraud
mm.
from not just people making claim and accidentally leaving things off, which is categorized as fraud, or hospitals billing us 6 times what they should be
Oh my.
and fighting to say we're not paying that claim yet because you're overbilling us,
Wow.
etc. It's I mean, from selling claims to people on the beach saying, hey, we'll give you half of this if you'll claim that you were in this hospital.
Really?
And yeah, so fraud is rampant in the industry, and to build better, with our health insurance, to have the Insured Nomads MasterCard to where we can drop funds on it. You pay right at the point of care. That wasn't a simple thing, even though it seems like it should be. Um, Getting the capacity
Mm,
for a young insurtech has not been the simplest.
mm.
And so to gain that through Allianz partners out of France to say, yes, we love what you're doing. We'll take the financial risk. So if
Wow.
everybody gets sick, they take the financial risk. To
Li-
get the investment backing, it has been a wild ride. So to get those small accolades along the way,
Yeah.
it's
Yeah.
are nice, but the real accolade is when somebody's like, okay, great, you've got good service, you've got a good product. That's what we're about, is
Yes.
making sure that when it's needed, it's there and it works well.
Yes. So if we probably have listeners who are considering moving overseas, and you and I are sort of serial expats or nomads from throughout our lives, right? So does your product, does it focus on for people who are about to make the leap and are about to transition their lives to become nomadic? Or is it for people who are currently nomadic? And I have so many questions. Why don't we start with those two?
Yeah, it's both, because we're all so unique. There's no cookie cutter. And
Right.
so to have tailored solutions to and chat on our website to say, okay, I'm not sure what I should get,
Uh,
because marketing, blogs, the things people say
yeah.
are so generic and they don't fit everyone's needs. Some people are looking at this nomadic lifestyle saying, I'm going to go for 2 months and then I'm going to come home, wherever
Yes.
home is. And that's
Yeah.
it. They're going to go for 3 weeks and maybe next year relocate long term.
Mm.
So they're nomadic for a really short period of time at times.
Yeah.
And then others are saying, I'm already here. I love it in Tbilisi. I love it in Panama, and I'm just going to stay. I'm going to stay at least for the next 4 years, or I'm going to stay for the next 40 years.
Yes.
And so there are a lot of different flavors of nomads. There are folks saying, I'm never going home, or I'm going home on short visits. When there's a
Mm.
wedding, a funeral, a celebration, I'm going home to see them and hug them. But besides that, I've taken on a new life.
Yeah.
And some people say, well, that's not a nomad. Well, it is. We're all nomadic at heart. Just some people never wake up that side of them to be
So,
curious.
so could the nomadic word be sometimes superimposed with the word migrant? Like I have expated around the globe many times, but now into Mexico. And so I could be considered a nomad, but could I also be considered migrant? And do you insure all types of migrants?
We do, actually. And that's a good clarification, because some people don't like the term nomad. They don't like the term expat. They don't like the term immigrant.
Triggered.
But yeah, we've got to take on some kind of label. It's a hello, I am Andrew or Doreen. It's a hello, I am
Yes.
new
Yeah.
here
Yeah.
or getting to learn this place.
Right.
And
Right.
you got to say something. So labels or not, we've got labels, even if they're invisible. And so sometimes it's just a travel insurance that's needed.
Mhm.
If you're just going to explore a place and think, I wonder how much cost of living is here. I wonder if I can afford to rent or buy a place here.
Mhm.
Wonder if I can get a long-term visa. And it's a vision trip sometimes. And
Yes.
that's all it's needed is travel medical insurance. You don't need cancellation coverage and all these other things that are added on that 3x the price of a coverage. You just
Ah,
need to cover medical so that if somebody veers off the road, hits you when you're walking down the street, you're covered. Not going to happen to you, but it happens to people out there.
right.
But sometimes people can work remotely or semi work and half retire,
Yes.
and they they want a private health insurance plan.
Hmm.
Doesn't have to cover their home passport country. It could just cover them in a certain region. Say
Mm.
you're going to be living in Nicaragua and you want to make sure that, okay, if I want to go to Panama
Mm.
where the hospitals are incredible, it's going to cover it.
Yes.
But yet premiums are going to be lower because they're not including Canada or US or whatever their home country is.
Mm.
It's a regional approach. They could be living in could be living in Egypt but
Yes.
want regional coverage, and they don't need to
Yeah.
cover all those expensive countries. And with us, you can actually have a local on your policy.
Oh,
You don't
wow.
have to be international. You could be French and get a policy with us, living in France. You could be from Costa Rica, living in Costa Rica, and get a policy with us. Because
Wow.
our capacity partner being Allianz, we've got that regulatory system in
Yeah.
place to where we can cover the local nationals, to where it's a thing of, I want to add my employee
Yes.
that is from the country where you're living. You can add them,
You know,
get that done.
that's something we should consider here.
Mm-hmm.
Because we have in Mexico, they're really asking our household help. Like we have a gardener who comes once a week, and there's a lot of reluctance to sign up for the system of the government system, and we have them sign every week when they get their pay and their pesos, and they take them away. But they don't want to get involved with the bureaucracy because there's not always trust. Different countries have different cultures of trust. And so it's
Yes.
good to know that if you are an expat and you have people that are working with you and for you,
Mm-hmm.
and that's to me is amazing because I did not
Right.
know it was available.
Or if you marry someone from that country,
Yes,
you can't add them to an expat plan, a traditional expat plan, because they're living in their home country. But with us, you can, because it's a thing of it's necessary. But we can keep costs down when you're not living in an expensive country. You can also reduce cost by having a higher deductible. That way, if
yes,
this is just something you want to do for catastrophic, if you actually end up getting diagnosed for something, you could get catastrophic coverage basically to where you have a full on health insurance, but you've got a $10,000 deductible.
excellent.
A couple of years later, you're renewing this plan. A couple of years later, you go for a checkup and they say, we've discovered this. You've got coverage. Sure. You're covering the first 10K or something, or the first 3,000, whatever your higher deductible is. You can eliminate the outpatient care and only get inpatient the way we've made it. That way, if you're considering this as catastrophic only, you're covering it when you're admitted to the hospital for a major disease, major thing. So that's one of those differentials to where you can customize your plan with
Mhm.
different levels so it can reach your budget, but yet transfer some of that risk on.
One of the biggest questions we get asked when since we've moved to Mexico, in fact, number one question, what do you do for health insurance?
Mm-hmm.
And it's uppermost in everyone's minds, especially if you come from the US. If you come from another country, there's different systems, there's different mindsets, and there's different expectations. But coming from the US, the first question is, what do you do about healthcare? And so
Right.
this is really good information for people who are considering moving outside their country or are launching themselves or beginning the plan of launching themselves overseas. So what is the most interesting conversation you've ever had with a digital nomad or an expat that gave you an inside perspective on their needs and their lifestyle?
Mm. I got a phone call one day. I can see right where I was. I was waiting for an elevator door to open. When my phone rang, it was a call from Malawi. And I
Mm,
thought, I better take this. I'd given these folks my cell number. And I thought, I better take this. It's Malawi. Didn't know who it was. Got it. And the guy said, my 13-year-old is in the hospital. It's malaria. And they said they've done all they can do at this hospital. And we're at the
mm,
best hospital in the country.
mm,
They said his kidneys are failing.
mm.
And what can we do? Their insurance plan with us had expired for lack of payment
Oh
about
dear.
3 weeks earlier.
Oh no.
Yes. And here they were saying, what can we do? They were able to pay that day, get it reinstated, and we got him medevac to Johannesburg to a great hospital. He was in intensive care for 5 weeks. He recovered, and I mean, doing well. They're still living in Malawi today, but they had a family plan that was probably about $8,000 a year at the time. This was a few years back, and I think their total bill was about $84,000
Oh my.
because the medevac that was situated within a few hours from that
Mm,
phone call was
mm.
all he was in the air. That was about 22,000. But then 5 weeks intensive care, life and death situation.
Sure.
It paid for a apartment nearby for the parents for a period of time, which is a cool thing. Most people don't know that travel insurance and health insurance pays for someone to come and be bedside with you and pay for their hotel room, pay for their flight. Most travel insurance and health insurance. Let me say that again. If you
And
get
help.
sick somewhere, it'll fly someone to come be with you.
Wow.
So it's one of those things where people don't realize the benefits that are there. So they don't use them.
That's amazing. That's amazing. So
Right.
I got sick down here in Mexico. My daughter, who's in Seattle, could be flown down here to sit.
In most policies, that's a benefit. So that is, and if you're traveling with a pet, it'll pay for kennel fees a lot of times. It'll pay for that pet to be flown back home if you're
Oh
if you're
my.
sitting in a hospital somewhere. So it's some of those things that people don't realize about insurance. There's another one though that comes to mind though that it was wild. It was a young guy in his 20s that I remember the dialogue from the very beginning to where he was saying, I've never used insurance. Should I get this? My parents told me I should reach out to you guys. And for a year, it was going to be about $2,000 for his health insurance. And he didn't have anything happen the first year. He renewed it. He was visiting in Chiang Mai, Thailand, visiting some friends there. Had a horrible headache. Went to the hospital just to have it checked out because he didn't have headaches ever. And they figured out he had a brain tumor
Mm.
that they said, we can't let you fly to Bangkok even. You need surgery. Altitude would really mess with it. You need surgery. He had brain surgery there in Chiang Mai. Insurance covered every bit of it for his $2,000 annual health insurance. And he kept renewing it year after year. And because he couldn't go anywhere else and get that covered because it would be a pre-existing condition
Sure.
that would be
Sure.
excluded.
Yeah.
So the benefit of having health insurance over travel insurance is that when that policy ends, you can renew it if it's health insurance. If it's travel insurance, it's only good for that trip. And when
Yes.
you get a new policy,
Yeah.
it's going to consider anything you have already as a pre-existing condition.
So does it make sense to get this health insurance even if you're just traveling a lot, even if you're just, doing corporate travel or tourism travel at whatever strata of travel you're participating in?
That's a tough question because if you're just traveling, you should have coverage in your home country,
Yes.
whether it's the government program in your home country,
Mm.
in Canada, UK, Europe, etc.,
Hmm.
or so that should be your primary. And then travel insurance would just cover you when you're outside your home country, since the
Okay.
government program or your home country doesn't cover you when traveling in most
Right.
cases. And Medicare in the US only covers maybe $50,000.
Mm.
And at that, it's quite limited. So if you can, keep that Medicare. If you're reaching retirement, keep that in place. But it shouldn't be your primary at all, because they're not going to evacuate. They're not going to transfer you to a hospital. They're not going to cover that bill as it gets higher and higher. So let's see. Having international health insurance, whether it's worldwide or just regional, could be really smart if you're spending a lot of your time in and out of your home country.
Well, this is really helpful because you kind of walked me through the process of, how you're all the different types of emergencies and also the different types of travelers and the different types of people that you serve. So how do you approach the pricing and the structures, especially for a demographic like nomads who are moving and changing and adopting new technologies, new ideas? I mean, there's nothing static about that community, correct?
Right. We're all so unique, and it's various levels of perception on need. So it's
Yes. Yeah.
and we all become experts in what we've experienced, but we haven't experienced everything, so we have to be constant learners. This is and you see so many people that are influential. They become subject matter experts in what they've experienced or what they've read or what AI is telling them. So you have to be careful about what you read out there, because it may not be accurate for your needs. This is a rapidly evolving world, and what we say today, tomorrow won't be what's indeed true for the next day. Most of us remember the Motorola StarTAC or the Nokia phones. Well, we're sitting here with devices that are basically as good as our laptops. But give us another 5-10 years, and those will be so obsolete. And the information we're reading may be so biased because people are getting kickbacks from the companies that they're recommending. So there's just so much information that we need to obtain. We need to research. We need to be able to ask questions.
Yes, and ask better questions all the time.
Right.
So what I hear you saying is that you approach this with a sense of it not being necessarily a moving target, but being sort of something that like yeast that is growing and changing all the time. So we have to be somewhat flexible, but also there is a heart and a soul for insurance, isn't there? Because I'm always the one that's looking for that. Global heartedness is my tagline. And so how can you help our listeners find the heart and soul that lives in insurance? Because it's such a beautiful purpose.
Yes. It's relational, not transactional.
Thank you.
It's not about not paying claims. It's about a product that pays for care when you need it.
Yes.
And it's for us on our side, we've got to work through the hard aspects of actually talking to those doctors who cared for you, getting paperwork. So that's not the fun part of verifying and getting all the documentation and looking through it to make sure they're not slipping things in, or we have to make sure when we start a policy that we ask all the right questions. And that's not sometimes that doesn't come across as relational. When we have to ask 100 questions, it seems so invasive. But yet we can't cover someone for cardiac incident if they had a heart attack last week.
Exactly.
I'm talking because that's something I've had happen to me.
Yes. Yes.
And because the risk is so high, we can't charge $10,000 if we're about to pay out $100,000 on a second heart attack.
Wow.
And sometimes people are so vague with their answers on the applications that it really requires us to ask over and over. And they're like, just go ahead and give me a policy, please. It's like, no, quit hiding information, or just be really specific in your responses. And then we can issue a policy. So it's that frustration at times where we want to be relational, but yet we're dealing with something so crucial.
Yes.
That we want to get it right. It's easy with a travel policy. You're going for 2 weeks, going for 6 weeks. Just type in those dates.
Mm.
About 3 minutes later, you have a policy.
Yeah.
But many times people, one, I want to touch on this. We don't have life insurance for this lifestyle, but I
Oh, okay.
encourage you before things have moved along too far in your relocation overseas, get life insurance
Mm.
because once you've relocated, it's a lot harder to get.
Yes. Yes. Yes.
Get a will in place.
Absolutely.
Get Yeah, some of these things that you're thinking, I'm just thinking about where I'm going next. No,
Right.
think about some
Right.
of those basics
Yes.
that need to be
Yeah.
done first. Power
Yes.
of attorney, and leave a copy with a few people so they
Yes.
know. Let them know where you are and who the phone number of your neighbor in your new country.
Very important. I did a workshop a couple of years ago on death and dying for expats. We should talk more about that and how to be prepared because it can if we're overseas and something happens that's catastrophic, it can be equally catastrophic for the people who our loved ones who are left behind.
Yes, and legal fees at times. If you're in an
Yes.
accident, you need a lawyer to represent you. If
Yes.
you end up getting a divorce overseas and you married
Yes.
someone in that host country, getting a
Hmm.
lawyer is can be costly as a foreigner.
Yeah.
So there's a simple product called Legal Guardian, which is one of our products,
Oh,
which
very
gives
good.
you, I believe, 20 hours of legal assistance every month
Wow.
for things like that. It's just you may have heard of something similar to it in Canada or the U.S. Called Legal Shield. That covers you in
Yes.
your home country. Legal
Yes.
Guardian is something that covers you internationally. I think
Okay.
right now we cover people when they're visiting or living in 116 countries. So we've got
Wow.
a network of lawyers ready for your beck
Right.
and call. And one of the other things I wanted to bring up, I know our time is rapidly passing, is not just the insurance that transferring the financial risk if something happens, but making sure your insurance has telemedicine.
Oh gosh,
Yes.
yes, yes, can I tell you, yes, because
Tell me a story. Yes, I hear
I
a
tried,
story.
oh gosh, when I tried to, first few conversations I tried to have with my GP, and we go back every year or every 6 months, it was 6 months last year for checkups and everything and all the health processes for big things in the States. And the first time he tried to call me on the telehealth, and then when big companies like Aetna try to talk to you, you got to have a VPN.
Mm,
You just, and actually, because the way it's set up in America, it's state by state. And so if you are not in the same state where they're providing you service, you can't even talk to them. I found that
yes.
so frustrating, and I was so naive. I did not understand any of this, Andrew.
Yes, and we've had contracts with some of the major providers in the world for our customers, and then that's the scenario. They're out of the country,
Yes,
and sorry, we can't help them because
yes,
they're not where they said they were when they bought the plan, etc.
right.
It's frustrating because they tout themselves as having global care. We for our travel plans next year and currently with all of our health plans, we've partnered with Doctor On Call, DrOnCall.com. That's DR on call, and
Okay.
so that's included, and it's 24 hours a day. The physicians are in the U.S. A nurse does the triage, and within like 5 to 8 minutes, you're talking to a doctor. There's no
Wow.
consult fee, no copay, unlimited calls with a prescription given if needed. And I mean, it's not for controlled substances, of course, but uh, you know, for you not to have to go to the hospital or to a
Sure.
clinic or a
Yeah.
specialist,
Yeah.
to
It's
be able
worth
to
it.
do a video or voice call anywhere
Definitely.
in the world, that
Definitely.
is powerful. And so wherever you are, if you can get telemedicine, I highly encourage it. I've lived in places where we
I do
couldn't
too.
find a doctor, and it's just one of those things where
Okay.
we feel it's crucial to have telemedicine, and we include the MD, the physician calls, and therapist calls with our plans because therapy is often needed. You see traumatic things, you go
Yes.
through different events when you're in this lifestyle. So we've included therapy with ours.
That's great.
Sadly, people don't use it as much as we wish,
Mm.
but that's one of those where we hope that people will use it, and we're paying for it. whether you use it or not, for telemedicine and mental health therapy sessions.
And I just have to say that in the number of times that mental health has cropped up in conversations and interviews with authors, experts, writers, and researchers in the international fields that I'm serving, it has cropped up with much more frequency in the last 6 months.
Yes.
And I think people are listening in and beginning to make it perhaps more of a priority. So this is great. I feel like just throughout this conversation, it's like Christmas. It's like an insurance Christmas you gave us. You gave us a lot of gifts. Like if you
Well,
use
wait. One of my favorites is airport lounge access.
Oh, really?
You know,
Oh,
a lot of folks think
yeah.
I never get sick, I never get ill,
Mm.
never get injured. I just, why am I getting insurance? Well, it's
Yes.
that thing. Your house never burns down. You never have a car wreck until you do. But
Right.
I'm with you. I've had seasons to where I haven't had to use it much at all. And one of my gifts, one of our gifts that we like to give people is airport lounge access. So with our health plans, you have unlimited airport lounge access through Priority Pass.
Excellent.
So that's getting you into the Centurion Lounge from Amex all the way to the some of the greatest new lounges in the world, like the Chase
Yes.
lounge that are in some of the new airports. And with our travel plans, it's through Instapass for delayed flights for 12 months. So we're including
That's great.
McAfee for cybersecurity,
Uh-huh.
so that you've got malware, antivirus, VPN for this
Wherever you are.
lifestyle that
Yeah.
comes with our health insurance. So
Yes.
for Christmas gifts, there's lots to unwrap with Insured Nomads.
I love it. I love it. So I wanted to say, just in closing, what is the biggest misconception that we, the public, have about the insurance business? I mean, we've touched on it a little bit when you talked about filling out our forms. We need to be forthright. We need to be willing. We need to be transparent. We need to be honest. So what else would you say that we, the public, need to know and or do to
Mm-hmm.
interact with your industry better?
Let's see. First takeaway, I guess, is to realize that it's going to require some patience on your end
Mm,
with documentation.
mm,
And I think having been a patient, having gone to hospitals a lot, whether it's with my kids, my spouse, myself, with friends, a lot of times we're just focused on our pain and getting out the door.
yes.
And then afterwards, we realize, oh no, I'm going to need some documents.
Mm,
I need to know the doctor's name. I need to know emails, contacts,
mm,
things like that. And
mm.
it's really a headache to have to call the hospital after you leave.
Okay.
So to get some of those basic email and contacts before you leave the hospital,
Mm,
because
mhm,
after you leave, you may have to get in touch with them again.
mm.
Or if it's filing a claim because your flight was delayed by 4 hours in your
Yes.
connection city. And travel insurance usually gives you about $1,500 when that
Uh-huh.
happens. But people don't know it. But
Wow.
yes, you're going to have to show some proof of that. So patience in the proof
Mm,
process
mm,
is my one tip,
mm.
because we love to pay out because you paid us some money. We'd love to give you money back. We just have to make sure that all of our processes are completed so that
Sure.
we can pay it out and justify paying it out.
And
That's kind of the headache, is dealing with gathering those papers.
okay. So you're saying be prepared, be organized, have a structure.
Yes.
I
When
seem
you're at your worst, when you're ill and injured. Oh no, really?
No, I think that I have a card, a laminated card, and it's for some sort of a process here that if you're in trouble in Mexico and you need to get we did buy some medevac insurance. I wish I talked to you first, but that's
Good.
okay. But we can be medevaced out, but it's a little card that's always in my wallet. This is my contact. This is my emergency
Mm-hmm.
contact. This is my emergency contact in the States. If I die, we joined the 24-hour society. And what they do is they go get your body because within 24 hours, you're going to be cremated in Mexico with no choices. That's the rule. And so they go get
Wow.
your body, they bring it back to San Miguel, They contact the embassy to tell the embassy what has happened, that you are deceased, and they contact your relatives. And you know, for me, it was worth that kind of. I love having that reassurance, and that's why we bought it.
Yes.
And so the products that you're talking about are products that are um, slowly, system by system, building up our comfort zone, building up our natural resilience and resources while we're living overseas. And so,
Yes.
do you have final last words for our listeners?
It's a pleasure to get to visit with you today. And I just encourage you in this lifestyle. Go further than you expected to go. Do something different. Try that different cuisine. Go
Yeah,
exploring
yeah.
and just live your best life. Always be on a quest to heal and be ready to grow. It
Mm,
takes the work, though. It takes work to learn, whether you're studying the insurance process to figure out
yes,
how much
yes,
risk you want to transfer or how much you want
yes,
to retain, or the
yeah,
language or the connectivity or the community
yeah.
or the sports. Take care
Mm.
of your body, exercise, find those places to where you can get community.
And you heard this wisdom from Andrew Jernigan, who is the CEO of Insured Nomads. Andrew, where can people find you? And we will put this in the show notes.
Insured Nomads
Mm-hmm,
on any social network
mm-hmm.
and insurednomads.com or internationalhealthinsurance.com.
Oh, okay.
And I'm reachable as well, Andrew Jernigan, on most social media networks, whether it's Facebook, Instagram, etc. Thank you all so much. Doreen, Nomadic Diaries, this is the place to learn and hear from the top guests. So, folks, give it a great review. Share it with your friends.
Thank you so much, Andrew. And for now, this is Nomadic Diaries signing off, and we say bye bye, hasta la vista, sayonara, and masalama.